Why is YouTube saying offline?
So,
It's not off. I'm looking at it here.
check the group. I posted the link in there. Refreshed it.
Which group? I'm already live. I'm not using the phone. Is there another link?
Yes.
Like, let me cut off this live. I don't know what you are doing. I don't know what. Where is the other link you say you posted? I beg.
Understand group.
Please, am I live?
Yeah, right.
Good evening, everyone. I'm very sorry for this technical glitch. I really don't know why we are not able to get ourselves together. I'd like to know where you are participating from. Please let me know where you are participating from. Today I have a very interesting topic I want to talk to us about. Talking to us today about why people fall sick, because a lot of time that's the concern that people have. Why am I having this headache? Why am I having this back pain? Why is my BP not going down? Why is this? Why is that? So today we are dealing with why people fall sick, and this cuts across different age group, not just adults. So it doesn't even matter the class, the status, but these are different principles of why people fall sick. And please, I'd like to know where you are watching from. Please drop your comments in the comment section. If you have a question, you can also drop it from the comment section. I can pick it up from the different platforms from which we are streaming from. Welcome you. So not to waste so much of our time, because it's just a 1 hour session. Last week during our live, I talked to Ross about the spiritual aspect of diseases. So I'm not going to be talking about that today, because spiritual aspect of disease is part of why people fall sick. But today, removing spirituality from it, which we have dealt with last week. Today we are talking about why people fall sick. So now I had to find why people fall sick, because it was something that I needed to know to be able to find answers, to people come to meet me regularly, so I really want to know that what is the reason children, adults, people, so as I did more study, more research, more findings, I found out nine, everything can be put together into 9. There are 9 reasons, 9 categories of why people will fall sick. So let's get into it. So the first thing for which why people fall sick, number 1, from studies across all platforms of different research sites and everything, number 1 could be as a result of infections. Now infections are invasion of microorganisms in the body. Microorganisms, either the one that someone picked up or the one that overgrow as a result of overpopulation of bacterial growth in someone's body. Because bacteria are part of life. They are part of the normal flora. They are normal floras that keep the body and keep the health. Thank you, madam. Oh, thank you from US. Thank you. That's 2 countries now, Nigeria, US. I like to know where other people are watching from. Please let me know where you are watching from, you know. So infections, so infections are why people fall sick. Infections like hepatitis, infections like HIV, infections, you know, all manner of pathogens, you know, which could be either bacteria, which could be viruses, which could be parasitic. All these are reasons people can fall sick. I'm sure you are aware of that, but as we go on, you will find some other reasons why people fall sick that you're not aware of. Apart from infections, the next reason people fall sick is lifestyle. Now, of course, we talk about lifestyle every time, poor lifestyle. You know, when we talk about lifestyle, we tend to look at, oh, people that smoke, people that drink. But smoking and drinking are not the only lifestyle that can make people to fall sick. Those are even smoking, excessive drinking are even categorized as risky lifestyle, you see. So when we're talking lifestyle, we're not even just talking about smoking and drinking. So what are some of the lifestyles that make people to fall sick? One lifestyle that make people to fall sick is excessive. Anything that you do in excess can make you to fall sick. For instance, number one, excessive exercise can make you to fall sick. Excessive activities can make you to fall sick. So anything that you do in excess, lifestyle, food, drink, even if it is a healthy something that you take excess of, can make you to fall sick. Did you know that? Yes. Too much of water can make you to fall sick. Not drinking enough water can make you to fall sick. You see, these are what we in the category of excess. So when we're talking about caffeine, excess of caffeine, even food, have you seen people who eat corn? They eat corn without control. You see, these things, something that should have been a health, that should have been something that should give you life, because you are doing it in excess, will make you to fall sick. So under lifestyle, everything that you are doing in excess, you know the things that the amount of soda you take, the amount of fried food you take, the amount of the less time you spend, the less amount of time you spend sleeping. So the excess work, the excess, everything you do in excess will make you to fall sick. The amount of stress that you are exposed to will make you to fall sick. So those are lifestyle that can make you to fall sick. We have under that increase, so under the excessive thing, it's excessive lifestyle. Now we have people who do not sleep, who over a period of time do not sleep. They sleep like maybe 4 hours in a day, or some even 3 hours in a day. Is, as simple as not sleeping. That excessive lifestyle of not sleeping, as simple as it is the foundation for which, thank you so much, is the foundation for which conditions like diabetes, conditions like hypertension, conditions like liver inflammation, conditions like persistent high cholesterol, they build upon these conditions. You see, so it's very important that you know that anything that you do in excess is going to make you sick. It's going to make you fall ill, because at that point you get into the side effect. Do you see people who drink juices? They drink juices in excess. Do you see people who drink lemon? They take lemon in excess. By the way, if you are not aware, on the 23rd of this month, which is just less than a few days from now, we'll be hosting our kidney awareness conference. It's going to be live in Abuja if you live in Abuja, but if you are not in Abuja, online, you can participate online. So you see, we're talking about why people fall sick, and I said one of the things that make people fall sick is the things that people do in excess. I'd like to know where you are watching from. Please let me know. We have counted 2 countries now. I'd like to know other people, where are you watching from? Drop it in the comment section. Now, number 3 reason. So under lifestyle, we have unhealthy diets, the things you eat. So when we say unhealthy diets, we're not even just talking about you are eating foods that are fries or certain kind of foods, even the food that is healthy, that you eat in excess, is going to make you fall sick. So in life, there's what you call moderation. Everything you do in excess, you will enter into the side effect of it, because everything has side effects, even water. So then, so excess of exercise or lack of inactivity or too much activity can make someone to fall sick. You see, excess of stress, whether mental, emotional, physical, we dealt with it last week, can make people to fall sick. Insufficient sleep can make people to fall sick. Substance abuse, drug misuse, drug abuse, excess drugs can make people to fall sick. So all this is increase the, I already told you that they form foundation for which other health conditions will form. Number 3 reason people fall sick, which is what I want everybody online watching me to pay attention to, is their environment. Oftentimes people do not realize the impact of the environment they are living in and their health. I'm going to mention some of the things, and I'm going to give you some scenarios. Number 1, we talk about from environment. When we look at environment, you are probably looking at my environment is all right now. We're looking at pollution. You just recently moved into an environment. So let me before I give scenario, let me just mention. So pollution. Now, pollution can be as a result of air pollution. Pollution can be as a result of water pollution. Pollution can be as a result of chemical pollution, can be as a result of radiation pollution. It can also be as a result of noise pollution. These things I'm telling you they can easily make you to fall sick, and you will do tests and there will be nothing wrong with you, but you are not all right. Just know that you are playing with environmental cause of illness. I tell you. So let's now go into it. Air. You move into an area, there's an area, I live in Abeokuta, Ogun State. There's this area where if you are journeying down, they produce cement. Factories are in that area. The air in that area, I tell you that the people in that area, the diseases that will be prone to them is respiratory disease. Because when you are driving past, if you are passing, if you look at all the trees in the environment, they all have settlement of dust. They all have settlement. They are not very green. They are not very okay. Now, if someone moved into such an area, and after a while, the person is experiencing some health concern, he is not aware. He is not going to be paying attention to his environment. If he's going to go and give history in the hospital, he's not going to say that I just moved to this environment. He's going to say I started coughing, and then I noticed that 3 months ago the cough started, and did you change it? Say no, nothing. No, are you smoking? No, I'm not smoking. No, but you are inhaling air, contaminated air. And then we have those people. We have water. The environment you move into. The environment you move into. You look at. I've talked about air, and then water. What is the kind of water that is found in that area? There are some areas in Nigeria that they don't have good water. The normal water that comes out from that tap is like muddy water, dirty water, that's the way it is. You now need to understand when you move into such an area, it's beyond saying I don't drink the water. You don't drink the water, you're using the water to brush your mouth. You use the water to brush your mouth, you use water to cook, you use water to wash your plate. This water that you said is not a clean water that has sediment, that is the water you're using to wash your plate and wash your spoon. When you start experiencing these things, you will not realize that the water is where the problem is coming from. You see, the water is where the problem is coming from. So it's important that you note these things of why. Because you must take stock of when did this problem start. Why am I saying this? Because I do a lot of consultation. And when I do this consultation, I find out that where people think their problem is not where the problem is. And then in exploring, I find that even if I give you treatment, the problem will not go. I tell them, I say, look, you have to pack from this environment. Because your problem is coming from, the problem started when you moved into the house. the water in the place. So I've talked about air, I talked about, then we talk about the paint, the chemical painting in the house that you live in. These are things that can make you sick that you may not even be fully aware of. Remember, we're talking about why people fall sick. Then chemical. So when we're talking about chemical radiation could be from the painting in your house. You know, with a lot of mixologies nowadays, the painting in your house, the apart from painting in your house, if you're working in a place, there are some people who work in places where they deal with gases, like, you know, they are engineers, they deal with gases, they are exposed to different kind of gas. That exposure to gas, the gear you are wearing may not be providing enough protection for you. That can be, even if it is providing protection, some form of protection, because you are constantly in that environment, there is no way there will not be seeping and leakage into your system. These things cause people to fall sick. We're talking about why people fall sick. And I talked about last week spiritual aspect, and I gave you scientific backing of how the things you do. So there's no spiritual, I'm not talking spiritual today. Today I'm talking about the things that make people to fall sick. And number one, I talked about your environment. If you just joining it, just go back and watch from the beginning. You know, so I talked about bacteria, different types of microorganisms. I talked about lifestyle that we do in excess. Number three, I'm talking about the environmental reasons why people fall sick. So we go into, I've talked about chemical, then we talk about radiation. Radiation. Someone asked me, what is radiation pollution? Radiation pollution comes from masts. Comes from, when I'm talking radiation now, please, I'm not talking about microwave. I'm talking about radioactive waves, exposure to radioactive, you know, waves. You know, there's a reason there are some masts that are set up, and they say that the normal living distance should be maybe 3 hours, not 3 hours, like, you know, there's a particular distance that, because of the radioactive, the radiations that come from this different kind of this mast, people should not live within certain meters. But you know how it is in Nigeria. How when those companies come, they be like, I want to rent your land, and you need the money, and people are looking for house. People don't pay attention to this. Now I'm going to give you a case of a patient of mine who reached out to me with different symptoms. Let me tell you some of the symptoms, not limited to, some of the symptoms that come from either chemical radiation, radioactive chemical pollution, radioactive pollution, electromagnetic pollution. Let me tell you some of the symptoms that the person will feel. The person would experience, in these cases, not all, but most of the cases. Now, the person will do tests. First of all, the test will not be pointing to any tangible problem. First of all, but the person is not well. Now, we have established that test results. The person will do all the tests, do MRI, do this one, do that one, do that one. Sometimes they may find spasms with queried cause. Because when they now do some other thing, it's not there, but they will find that the test could reveal spasms. That's one thing. Now, what are the symptoms that the person may experience? Symptoms like electric current. The person will just feel like, suddenly there is a shock. They will just suddenly feel like something just run through them. Brrr. That's one way. Sometimes they experience numbness. You know, the whole symptoms are always usually in the path, along the path of fluid, something flowing through my body. It's always in the nerve. That means you have been exposed. And one litmus test for you to even check this evening, as you are hearing me like this, so I'm telling you, if you walk past television, your television, just walk past, and the hair of your body just go and stand up, know that you yourself, gone safe. You are now a conduit of current. You are carrying, you are transferring, you are transmitting, you are conducting. I don't even know how to speak the English at this moment. But I'm just saying to you that exposure to environmental toxins can make you to fall sick, can make blood pressure readings to go up and not come down, can make people to have headaches, can make people to have discomfort, spasms, constant muscle twitching in the body. These are things that happens as a result. So I hope I've answered your question about radiation pollution. Now, environmental issues, we go environmental factors people fall sick, we enter hygiene and sanitation. Poor hygiene, poor sanitation. Poor hygiene, poor sanitation. When last did you disinfect? Do you know that people come to your house, your chairs, your furnitures, do you know you're supposed to disinfect them? They could carry bacteria, they could carry surface viruses. There are viruses that don't die. They can stay on surfaces. Even some fungal infection, they can stay on surfaces. They will not die. They are just there. And then you come, they pick it up, you pick it up, you use your hand, you touch your face, you touch your mouth, these are different things that people do. So you need to disinfect. How do you disinfect? I always tell people, if you have vacuum, what do you call this vacuum thing? Take hypo solution. What is a hypo solution? Hypo solution is a solution that hypochloric solution, like your everyday disinfectants in the house. These are normal. This thing you dilute it 1 to 1, like 1 in 1 liter of water, 1 cup, maybe 50 ml to 1 liter of water, and then you put it in your spray. Use it to spray. Don't just clean your curtains, clean your bed, clean your chairs. Disinfect surfaces. Disinfect. You see, very important. You disinfect because you are not. It's not as if when you are disinfecting, you are not trying to be what's the word? Obsessive. You are trying to protect your environment. You are trying to clean your environment to make sure that there are not opportunities for you to fall sick. Remember, we're talking about why people fall sick, right? So then another reason people fall sick, the environment where they work, the safety. We're talking about physically now. Living or working in environments where there is no safety, like you work in places where they deal with sharp objects, they produce things and they can cause injuries, so high risk jobs, operating machineries, different things that people do can make people to fall sick. Running along, seasonal climate or seasonal changes can make people to fall sick. There are some during dry season. We are getting into the dry season now in Nigeria, while in the other countries they are getting into winter. Gradually, summer is finishing, going to winter. During this period of cold, when the weather is very cold, because of the dampness and the coldness of the weather, it makes some bacteria that have been quiet, those seasons make them more active, particularly when people are prone, because of these same environmental factors I'm talking about, can make them to fall sick. You see, so seasonal seasons, dry season, a lot of pollens from dust being carried from place to place, a lot of airborne bacteria being transmitted from place to place can make people to fall sick. Now, number 5 reason people fall sick, we look at their genetic. Genetic has to do with their family makeup. That is why it is very important to take history of your family. Take history to know what killed grandpa, what great grandma, what are the conditions that people have in the family. You see, these things are very important because they determine what, when we say genetics, let me explain it. Even though genetics are they are the makeup of an individual, beyond makeup of an individual, they are like a signpost. When you see 20 kilometers to Lagos or 20 kilometers to Ibadan, 15 kilometers, 10 kilometers, those are what genetics are. Genetics tell you that great grandfather had this condition. It's like a signpost. Grandma had this condition. It's like a signpost. That something is genetic does not mean that you must have it. it means that the chances of you having it is much higher than some other person, because it is there is a family history of this thing. Now what does that mean? It means that you can use that information to make better decision, to make sure that you do not now have it when you are not, especially when you are not already manifesting, when you have not yet manifesting those symptoms. So it's very important that you understand your genetic makeup of your family. What if, what are the things that are peculiar to people from my side, even from the family you are marrying into. It is very important. Take history. Know what they are prone to. Know, because by the time you join yourself to somebody, your children, you are going to be mixing together to form something new. That something new is a carryover of all that is in your own lineage, because the person's lineage, you join together, you go and form something new. So you need to know. You use this knowledge to now make better decisions. So somebody comes to tell me, I usually have this often time when people come and say to me that, okay, so I have this case of this woman. She's in a 78 or something like that. She's probably going to be joining us online now. Or maybe she will join, or she's not here. Maybe she's, I'm going to check YouTube, maybe she's there. So she was telling me that her auntie is I think 90 something years old, and the auntie can walk very well. The auntie is not having any complaint and all that. Now, so why is she having it? And I said to her, I said, ma, let me say to you, I said the body will reveal itself through this weakest point. Now, when somebody has a genetic tendency to arthritis or bone related problem, for instance, let me use the bone for instance. Somebody has a family history of bone related problem, then the person loves inflammatory foods. By the way, I have done a video on inflammatory foods. Just go on the page, this page, wherever you are watching from. If you are watching on TikTok, go, when the video ends, go and check 8 inflammatory foods that can trigger bone problem. If you are watching on YouTube, go and watch. You will see it. On Instagram, it's there. It's on every of my social media pages, right? And if you are joining me for the first time, welcome home. Subscribe, follow, and go and watch videos. Many of the questions you are going to be having, I have answered them in the past. I'm telling you, go and check. And if you feel like I've not answered it, don't worry. Send me a message via DM. I'm going to deal with it in my next live. Topics that I've answered, I just say go and watch it, but then I deal with new topics so that we don't have keep repetition. But I decided to talk about why do people fall sick, because it's a fundamental to every complaint that people have. So you need to now take a stock and find out, okay, so I was talking to you about this woman, and this woman said to me that, her sister can walk very well, that her auntie can walk very well, doesn't have any complaint. Why then is she having this problem? I told her, I said, ma, it so happened that out of 7 identified scientific inflammatory foods that can trigger, when they say trigger, these foods are not bad, but when you have high levels of inflammation, if you now indulge in liking this particular set of food, it's like someone that has small fire, spark is doing pam pam pam, then the person goes and pour petrol inside that spark, then the fire is burning. Then the person is now using water spray to spray the fire. He's spraying it. He's spraying it in terms of he's taking drugs, he's doing some lifestyle thing. He will spray the fire to go off. Then he will spray maybe the volume of fire is maybe 500 ml of fire. Then he will spray like 50 ml of solution to the problem. Then maybe the solution is trying to douse it, he will now go back and eat 150 ml of inflammatory food. Fire will increase to 700. Then he will say the treatment is not working. I did this treatment, it's not working. I've used this, it's not working. The inflammatory things you are eating, that is causing you to have this problem, you have not dealt with it. So you see, inflammatory foods. So when people are prone to have a genetic tendency towards a condition, it means that if you follow this road, you will end up, if you drive if you enter a plane going to Johannesburg, if the plane is a direct flight to Johannesburg and you enter from anywhere that the flight is going to Johannesburg, it didn't matter how much you are praying on the aircraft, it didn't matter what you are doing, it didn't matter, you will land in Johannesburg. That's why I'm telling you today that there are things that you are doing that because you have a genetic predisposition, their environment you are living in, because you have a genetic predisposition, if you continue at it, you will fall sick. If you continue doing it, you will remain sick. It will not matter what treatment you are doing. You may see some changes and then you will be relapsing again. So you need to pay attention to these things. So that is genetic. Now, number 5 reasons people fall sick is the state of their immune system. There are several things that can make someone's immune system to be hyper. So when we're talking about immune system now, this is your immune body. This is not bacteria. This is not virus. This is your body's defense system. And your body has quite a different types of defense system for different purposes. To make this a very friendly and easy to relate with, that's why I'm not going to be going into a lot of medical jargons or industry jargons, as they say, So now, please, I'd like to know where you're joining from. I'd like to know if you're learning. I'd like to know if what I'm saying is making sense. Please respond through the chat. I can easily just pick it up from all the chat. That's why my eyes is turning around like this, so that I can see I can see if I'm making sense to you. So there are different immunobodies in the body which serve to do different function in the body. See it as your normal defense in the society, right? Now we've established that. Now there are cases where people fall sick because their immune system is hyperactive. When I say hyperactive, I mean that the immune system is perceiving cells of the body as the enemy. There are quite a number of conditions like that. These are conditions where the immune system is attacking directly the cells of the body. Now this again comes to the reason people fall sick. The reason someone is falling sick may be that back pain, that liver problem, that kidney problem, may be that heart problem. You see, when the immune system is attacking, it can attack any tissue of the body. Any tissue whatsoever can be under attack. So that's why it's not good for you to just quickly see a general therapy and use general therapy to do a specific treatment. No. General therapy we talk like now. I'm talking generally. I'm not talking to anybody in particular. For me to answer anybody in particular, there are several factors that I must put into consideration. Thank you so much, man. Yes, thank you for your feedback. Please, from Facebook, I'd like to know if you are hearing. Please drop your comments. Let me see your comments from YouTube. I'd like to know. Please drop your comments also. So I'm saying to you that when someone is having hyperactive immune system, if they are not careful, it begins to get worse. They begin to get sicker and sicker. Why do they get sicker and sicker? They are getting sicker and sicker because they have not been able to know that the problem is that their immune system, their own immune system, is what is fighting them. So that's why some people fall sick. That is the reason for some people's bone problem. That is the reason for some people's skin problem. That is the reason for some people's different problems that people have. You see, it could be hyperactive immune system. It could also be weakened immune system. Weakened immune system could mean it's not that the system is hyperactive. This one is that this immune system is reduced. Why is it reduced? It's reduced because of exposure. Exposure to certain things can weaken the immune system. What are the things that can weaken the immune system for someone? Thank you so much. Yes. What are the things that can weaken the immune system for someone? Your lifestyle can weaken the immune system. Whether it is risky or whether it is moderate lifestyle, it can weaken someone's immune system. Infections can weaken someone's immune system. You see, your emotions can weaken immune system. So there are several things that can cause someone's immune system to be weakened. Now, let's go on. Why people fall sick? Number 6, we have emotional reasons. Emotional reasons can cause a lot of stress. Mental reasons can cause a lot of stress. Both joined together can cause people to fall sick. We have cases of, let me even give you, some days ago, I remembered an incident with a patient of mine. This story I'm giving to you, is a story that anytime I remember, I will just burst laugh. Okay. So, she said that this person in question, she's a very educated somebody. In fact, she's a very, very, very educated somebody, very top ranking government official. I don't want to call the person's rank. But she said that she now saw a picture somewhere. When she saw the picture, she saw a picture of, she saw on the news that rapture now took place. That some people have disappeared, that some people were disappearing out of the earth. So when she heard that some people have disappeared, she now said, let her call me. That she knows that me I'm a Christian. Whether me self I have disappeared or I have not disappeared. Okay. So she called my line. It so happened that I'm talking about how emotions and mental stress can make someone. So I'm giving you a scenario. So she said she was not calling me. It so happened that I had a private consultation with someone in a government. Well, it's with someone that works for the government. So in the course of that consultation, I had to turn my phone on silent and put my screen down. So I was not seeing that my phone was not ringing out. Neither was I seeing my phone. I was not seeing any message. So she called me. This person doesn't call more than twice for any reason. But this person had given me like 70 missed calls. When she did not hear from me, she didn't hear from all the people that she was calling different people, they were not picking. She now went into a panic attack. Instead of all this panic, she fainted. They rushed her to the hospital. They fixed drip for her. So, myself, my own family members, they knew I was traveling to a particular location to see someone. It so happened that there was a protest in that environment. I didn't know that there was a protest. So I was already there before the protest started, or I can't even remember. I just saw people gathered, but I didn't know it was a protest. I just went my way into the place and I had my consultation. Then I now found out that the person, there were a lot of noise outside, but I finished my consultation. And then I was about leaving when I picked my phone and saw over 100 missed calls. When I saw over 100 missed calls, I was very okay. I was fine, no issues with me, very fine, happy. I finished my consultation. By the time I saw over 101 missed calls, my father had called, different people have called me. It just happened that different people had that 101 missed call came from different people who are dear to me. Patients, different patients, this particular patient. So, different things. By the time I saw it, my own heart flew away. I flew away. And then I started having headaches. Water started coming from my eyes. What was the matter? I was like, I hope somebody did not die. Then I now started calling my parents back. They were not picking call. Ha! Wetin happen? Hey, as I'm telling you, me that left there feeling okay, I was already trembling. My whole body was shaking seriously. I couldn't reach any. I was calling all the people. So I said, okay, let me even call this woman that had given me 70 missed calls. Only for me to call her. By the time she explained her narration to me, she was on admission. They had fees drip for her. Her BP was high. They were trying to bring her BP down. So when I called her back, she was sounding very, very, she was sounding like someone who has been sick for very many months. I'm like, hello ma, what happened to you? What? And then she said that, look. I burst. I felt about burst into laughter. Before I now recalibrated my brain, I said, no, you're not supposed to laugh. Don't laugh. Anyway, and I told her, I said, what kind of news did you hear? Why did you? Anyway, long and short of the story was that the news that she heard, or the information that she perceived and interpreted, immediately manifested into symptom of a disease that made her to be admitted into the hospital. Now, why am I saying this? Your emotions, oftentimes, I've talked about how people suppress their emotion, and I'm telling you the truth, that the truth is that when you ignore your emotions, the symptoms that come up, when people go to do consultation, they talk about how they are having headache, they are having palpitation, they cannot sleep, they have weakness in their body, they have these symptoms, they have that symptom, and then they talk about the problem started like 6 months ago. They talk about everything but what was happening to them at those times. So by the time you begin to dig deep into it, you are finding out that at this time, this person just had a breakup, this person just had this, and then you also find out that there are people who have unhealthy attachment to people. Unhealthy attachment to people in the sense that, women are more prone to this. A woman gets married and then she has a child. She gets married. Before she got married, she has friends, and then she got married life and all that makes her pay attention to her new family. She cuts off social relationship. She cuts off friends. I want to say to you today, if you are hearing me, that is not, you need friends. You need people. A human being is not someone who lives in isolation. A human being needs, you see, the problem is that you have an unhealthy attachment to your child. The relationship gap that you have with other people, you decide to pour all your emotions into your child. Your child that is 1 year old, your 2-year-old child cannot be your life, cannot be your spinal cord, cannot be your confidant. Your child is not your confidant. You should have your own friend that is your own age group, that all of you are age mate, that you can talk to, not your child. So, you see, because that may be the reason your social life, remember, health is a state of physical, mental, emotional, or social well-being, not just the absence of disease. So somebody can be unwell, someone can fall sick because emotional life is not all right. So I told this guy, oh, thank you so much. Hey, hello. So I told this guy, thank you for joining. Let me know where you are joining from. I'm seeing quite a number of people that I know. TikTok, IG, Facebook, YouTube, So he has issues with his relationship. Instead of him to deal with his relationship, he put all the love and the attention on the emotion on his 2-year-old. No. Now, because he has unresolved issues, he's having palpitation, he's having chest pain, his blood pressure is going up, the blood pressure is not coming down, he's not sleeping well, he's having pains. All this. you need to work on the reading. You need to have tough conversations with people, so that you can deal with it. So people fall sick because of emotional reasons, prolonged emotional reasons. Another reason that people fall sick is hormonal imbalance and nutrient deficiency can make you to fall sick. And that is the truth. Your hormones are important to your body. They are important to your health. Nutrients, the body is made up of a lot of minerals and nutrients, soluble and non-soluble, and then the one that your body stores and the one that your body does not store. All of them work together to provide your body with the required energy for it to be able to work. So I often have people who tell me that, oh, I eat a lot of vegetables, I eat a lot of good food, but they will be manifesting symptoms of different vitamin deficiencies. Vitamin A deficiency, vitamin B, vitamin A to Z. I have done a video on the different types of vitamin and their sources. That is vitamin A, vitamin B, vitamin C. They are natural sources from food. I'm not talking about supplement or anything. I'm talking about food now. You see, because before you go into taking any supplement, you should have a laboratory test to show that that you are lacking it. Don't just go and buy. Remember that part of the things that can make you to fall sick is anything you do in excess. So don't just go buy supplement and be drinking. Just be drinking. Drink if you are deficient. A lot of the vitamins, whether water soluble or fat soluble vitamins, are abundantly available from the sources, from natural sources. The problem is a lot of times people don't eat well, or they eat too much of one class of food and less of the other class of food. Another thing that people do is that people, they do less. Then another thing that people even now do is that they now even avoid certain classes of food. Okay, I'm not eating this, I'm not eating that. You need a little of everything in the body. A little of everything is needed in the body, because if you don't get everything, little of everything that your body needs, you'll find that you'll be deficient. And when you are deficient, if you're deficient in potassium, you're deficient in magnesium, manganese, sulfur, zinc, the functions that those minerals and vitamins are supposed to provide in the body will make somebody to be sick. You see, so across all ages, across all classes, these 8 things that I've listed today are reasons, they form reasons by which someone can be sick. You see, they form foundation for which someone can be sick. So you need to take stock of yourself. When did this problem start? How did it start? Where was I? Where did I go? Did I travel? I've had people who come and tell me that they have some skin itching, skin allergies, skin condition, very bad, terrible, bad skin conditions. And then as they reach out to me to say, oh, please, I'm having this health condition. When did it start? They say it just started. Has it happened to you before? No. Or yes, it used to happen to me. And then I found out that this person traveled to a particular state in Nigeria. And where this person traveled to, that area, I happen to have been to that area before, and I am aware of some particular kind of plants that are found in those areas. Now, because I know plants, I know that. So I asked the person, did you did you travel to any place? She said he went to so place. He went to visit his sister, and when he went to visit his sister, he now went to the field with her. How did he even say it? Anyway, what I'm trying to say is that exposure to a particular kind of plant from the environment was what caused him to have. So that particular plant has some toxicity. That exposure to that plant is what is triggering that skin irritation that he has. So what is happening for him is that he is actually experiencing an allergic reaction to exposure to that plant. And so I had to tell him. And so by the time okay, I'll answer your question. By the time I had to now take inventory of what has happened, we ran through it together. Then he realized that I can't give you so much more details because it's his personal case, but I'm just saying that the only reason he got that problem was because he went there, and he keeps going back to that place. So I told him, you need to stop going there. And then he told me, he said, the sister's children are also experiencing this same thing that he's experiencing. So I said they need to move out from that environment, because that plant has that tendency. And so as far as they're exposed to it, so this is how much environment can cause sickness for someone. If you don't know, you will be doing treatment, you will be doing therapy. You to look as if, I did this therapy here, I did therapy there, the therapy did not work. It's not that the therapy did not work. The factors contributing to the problem have not been identified. Because they have not been identified, they have not been rectified. Because they have not been rectified, there cannot be a lasting solution to it. So I'm going to be taking questions now. Because so I have a question from Instagram that says, how do we deal with this immune system? How do we deal with this immune system fighting the immune system? So I think the person wants to ask, how do we deal with immune system fighting the body? Now, autoimmune disorders, your immune system cannot be eradicated. You need your immune system. Usually what we want to now find out is when someone, before we can say that your immune system is the one that is the one, there are tests that there is only laboratory results, you see, that brings that out. So when laboratory results shows that that the immune system is attacking the cells of the body, then you also now want to find out what are the lifestyle that are making the immune system to be triggered. What are do you understand? So there are a lot of things. So you now work with your physician, work with your doctor to now find out, okay, what are you doing? In some cases, in most cases, certain food guide, certain diets, certain treatment will not be initiated. What is the treatment supposed to do? It's supposed to just actually calm down the rate. The treatment is not to fling away the immune system, no. It's to calm the hyperactive, burning, to calm it down. Usually that is what happens with hyperactive immune system, and there are quite a number of cases like that. There are a lot of autoimmune conditions, and then also they now want to look at which part of the body is being affected right at the moment. Is it affecting the joints? Is it affecting which part of the body is being affected? Is very, very important. That part of the body that is being affected now needs to be cared for. Therapies are now done to care for those parts of the body to make sure that the body is not the body doesn't eventually lose that part of the body. Now I have a question here from trying to look at the question from TikTok. It says fibroid is eating me. I've undergone 3 surgeries. Okay, so sorry about your condition. Now if you participated from the beginning of the live, when I was talking about why people fall sick, I talked about hormonal imbalance. Now you said you have fibroid from this person here, and the person has undergone 3 surgeries. Fibroids, myomas, are abnormal tumors that grow in the uterus. Okay, why are you now? That means you have done surgery 3 times, because from what you are saying, you've said you have done surgery 3 times. That is because you have been treating the outcome. The cause of this fibroid, have you identified it? What is your hormonal level? Do you understand? There are a lot of things that you need to look at. For you to have done surgery once, surgery second, surgery 3rd time for this same fibroid, it means that there is something else that is the you are looking at the building, or you are looking at the fruit. You are not looking at the roots of the problem. You need to deal with the root of the problem for you to be able to have a lasting solution. You see, so there are several things you need to now look at beyond. If you have done surgery 3 times, I don't even advise you to do another surgery. I mean, that's 3 surgeries on your uterus to remove fibroid, 3 times at different times, plus the surgery, plus the process of healing, all that you have done 3 times. Then the fibroid is not what you should be looking at. Out of all these factors that I've listed now, which one of them is causing it is what you need to find out. You need to find out. Then their diets, there are certain things that we eat. I've done a video on how fibroid forms, how the body forms fibroid, what to do, even things to avoid and things to eat if you are dealing with fibroid. Go, and the video is on this page that you are on. Go and watch it. You will learn quite a number of things from it. You see, you will learn quite a number of things from it, but you need to find out what the root cause is. What is your hormonal level? We can't talk about all that in a meeting like this, but it's very important that you know what your hormonal levels are. What are your hormonal levels? Aside from your hormonal levels, check your thyroid levels also. You see, there are lots of tests that you need to check. Laboratory results, you need to do tests. Test is going to, and when I'm talking tests, it's not just to go and do scan. When people have fibroid, they want to only do scan. Scan said it's not scan alone. You need to wait in your blood. They talk. Your blood works. There's a common test that I usually encourage people to do among all the different blood tests. That test is a test that checks inflammation. You see, that test, as simple as that test is, it tells you the impact of the lifestyle that you are living immediately. If that lifestyle is, you say, before you say I live healthy, I eat well, I drink water, I eat fruits. When people see me, the first thing they want to say, Dr. Etta, I'm always eating healthy. I'll just be looking at them like, you're always eating hair. Why are you now sick? And I told you, I said anything you do in excess can make you to be sick. Herbs that you drink, some of the herbs you are drinking, some of the go-go remedy you are drinking, there are some plants that increase the rate at which the body will form abnormal tumors. If you are drinking those things, you will continue to do surgery. You will continue to do so. So there are lots of things that need to be looked at, I tell you. And there are lots of things that make people to fall sick. And all of them, you can find them within these 9 reasons that I have given you today of why people fall sick. If you look very well, find out. I'm going to round off with a story of one of my patients. This is my patient, and I'm particularly talking about this patient because this story, I'm rounding off with this story because I want you to pay attention to everything that I've said today. Now, this patient of mine has suddenly just came up with high blood pressure. The blood pressure is not going down. I'm like, why is your blood pressure not going down now? Blood pressure is not going down. Blood pressure is not going down. Blood pressure is not going down. Why is blood pressure not going down? So she's on medication. So I say, okay, you know what? Okay, I'm going to answer your question now. So she said, so why is your blood pressure not going down now? You are not, you know how someone that you have followed up, you know, you have followed them, they do their tests, send you, you say, okay, it is, you know, she doesn't smoke, she's not drink, she does not hypertensive, she's not diabetic. All of a sudden, this person's blood pressure is not going down. You know, she just comes and said, my blood pressure is 130 over. I said, okay, go and sleep. Small time, my blood pressure is 150. Small time, I said, madam, what is, something is not, so it's something, the blood pressure seems to be triggered. Okay, I said, okay, take some time off. Each of the time I'm calling her, either I usually have the time to call her late in the night. So this particular day, it just came to me that, I should call this woman very urgently. So I just carried my phone and called her. My dear people watching me, the noise that was in her background, mind you, this woman is a single lady. The noise that was in her background was so bad that I couldn't continue the conversation. I said, excuse me, madam, please, where are you? She said, I'm at home. I said, what do you mean by you are at home? She said, I'm at home. I said, is this your house? She said, yes. I said, what is happening? She said she just moved into this place. I said, how long now? She said, like about 3 months. I said, madam, your BP is not about to go down. I said, me that I'm talking to you, I beg, the noise from your background is giving me a headache. Please, I need to drop the call. Let's continue as chat. When I say noise, if you hear noise of children beating, some are beating bound, some are screaming. They are screaming from their own flat, in her own house. Now, this is the kind of work this woman does. She works shifts such that she's in the she can be on night, she can be on day. She can be on night, she can be on day. So either night to morning or day to evening. Now, this BP started since she is on night to morning. So she will come back in the afternoon. Then it so happened that school are on holiday. Hey, Jesus. If you hear noise, so the noise, she's not able to sleep. Remember, she will tell me, if I ask her, are you sleeping? Are you sleeping? She say yes. She will say at night. She say yes, I'm trying to sleep at night. But you know my work. I say, okay, since you do night work, there has to be a time where you can sleep. This is the daytime that she's not able to sleep. I told her, I said, madam, she said she just moved into this place. There's nothing she can do right now, which I understood. I said, you need to do a getaway from this house. That is, get away from the house, go to somewhere. So she traveled out of her house, went to a hotel or somewhere to go and stay like 2 weeks. In the course of that time that she was in that place, her blood pressure, because she had gone to hospital, they gave her BP drug. You mean I even gave her heart care? I gave her anti-stress for all that one. So nothing. BP was just climbing steady. I say, something else is happening. Her test results, cholesterol number, lipid profile normal, heart normal, this one normal, but blood pressure is, and this blood pressure started suddenly with serious headache. So my dear people, the impact of your environment, do not underestimate it as to how it will affect your ability to be healthy and affect your ability to be well. The noise from the people around you, the noise of generator, even the heat can be a reason you are not well. So all these things, take stock of all these things together and look at how much it is impacting on your health at the moment, and make sure that you take a different decision. You are not going to be making the decision on emotion. You are making the decision because of your health. You can have 1,000 challenges. Oh, challenge of your job, challenge with your marriage, challenge with your children, challenge with your this, challenge with your that. You can have 1,000 challenge. You don't have any challenge. You can have 1,000 challenges which are pressing, dragging you, and they are serious to you. But if you have one health challenge, as simple as headache is, you will find out that all those 1,000 challenges that you have, they will not matter anymore. So take a stock of these 9 reasons people fall sick and find out how it is directly impacting on your health, and how you are going to make a detour. You need to make a detour, because if you enter Bonto going to Agege, you cannot be speaking in tongues and be expecting that motor going to Agege will land you in some water. No, it is Agege that is the final bus stop. The same thing, if you play within these 9 factors, it didn't matter whether you are rich, whether you are an adult, whether you are a child. This cuts across. I took my time to study different researches across the world, across why people fall sick. They fall into these 9 categories. If you can identify your own, if you can identify from the roots, from these 9 causes, you can be able to tell why are you falling sick, and then you can be able to know what you need to do, who you need to consult with, what lifestyle you need to make changes on. Now let me take this last question. I need to do what blood test I can do to know what vitamins. So you can do a vitamin analysis test, but before you go and do a vitamin analysis test, you need to do, there are other tests that you need to do. You see, there are other tests that you need to do to know whether it is vitamin deficiency. Before you are going into vitamin check, to check whether you are lacking a particular vitamin, you know, you also need to check your organs. You must make sure that all your organs, all your hormones, your thyroid, you see the everything, that the whole systems and organs that are supposed to do the things that are supposed to do, that they are all very okay. You understand what I'm saying? So, but of course, in the course of a lot of tests, a lot of these minerals are checked. In the course of a lot of tests, you find them. It's just that a lot of time people don't pay attention to all those things. You do that in a lot of all these tests, your calcium levels are checked, your phosphorus levels are checked. But then, if there's now if because there are a lot, you will spend money, you will be spending money going to do one test, check vitamin D, check vitamin E, check all those tests one by one. But there are tests that when you go to these labs, they have their packages that cuts across. But then also too, what we want to achieve, what you want to achieve, is you just want to know whether you are lacking a vitamin. So, are you lacking a vitamin? Why do you think you are lacking a vitamin? You see, that is the question that I'm asking you now. Why do you think you are lacking a vitamin? Then if you think you are lacking a vitamin, what are the symptoms you are experiencing? Now, when you say you are manifesting those symptoms, are those symptoms isolated to just that, or are they other things? So you see, it's a whole, you require an assessment, you require a consultation where your own peculiar case can be looked at, and then you can now be directed, so you don't waste money going to do tests. If you go to a lab that you just want to do vitamin analysis, you want to just check your vitamin levels, they will want you, there are other tests that you will need to have done before you get to that point. So I hope I've been able to answer your question. But of course, yes, there are quite a number of routine tests that people do. It's part of a lot of maybe not all, but significantly a lot of the tests that are done is there. But because people don't understand the interpretation of their results, they don't even are able to check, to know what those minerals are and what those values are and what they are supposed to do and what conditions they have to do. Yeah, in what conditions do they have it? So I'm glad that you have learned all the things you've learned today. I usually do not like my life to exceed 7 o'clock. I'm already 15 minutes past 7. If you've just joined, please just scroll back to the beginning. The videos will be left online. Just scroll back to the beginning and watch the program. Now on the 23rd of this month, which is less than, today is 14, today is 15, less than 7 days from now or so, or 8 days from now, we are going to be having our kidney conference, our kidney conference, and it's going to be holding on the 23rd of September to 3rd of September from 12 o'clock to 2 o'clock. It's a 2-hour session. Now the session is going like this. The session is going to be 1 hour of teaching on the things that people are doing. It's a kidney awareness campaign while raising great sensitivity about kidney diseases and what people are doing that they are not aware of, that is reducing the kidney health. So it's not same. I can tell you that we've had a conference, physical conference in Asaba. We had the conference in London. So if you are not in Abuja, you can log in online. The link for you to be able to participate on that day we're not going to be streaming on Instagram. We're only going to be streaming on our YouTube platform, and for you to be able to access it, it's very good that you register, so that when the link is shared, you can have access to the link and you can be able to participate in that event. Kidney problem is rising. Everybody is saying it, left, right and center. People are saying that kidney problem, kidney problem, kidney problem. Now that we are saying that kidney problem is rising, what are we going to do about it? I am having this conference. It's a free to attend conference, because it's a you with information so that you can make good decision, as well as help your children and your teenagers to protect their kidneys. So on the 23rd of September, please remember, mark your calendar, log in 12 o'clock to 2 p.m. 1 hour for the session, 30 minutes to take case studies, take questions from people who are physically present, 30 minutes to answer to people who are online, or 20 minutes to answer people who are online, 10 minutes to recap. First come, first serve. It's free to attend, first come, first serve. So please, I need you to make sure that you kindly register and be a part of the program. I thank you for being a part of this. God's grace, I shall be coming to you live from Abuja, because I will be in Abuja by this time next Sunday by God's grace, setting up and preparing for our kidney conference. This is me signing out. My name is Dr. Jabin. My name is Dr. Rita Jabin. I am a naturopathic doctor. I've been practicing for over 12 years now. I've helped thousands of people to be well. I desire to see people to be well, and that's why I come up to talk about different things that people can do to be well. Not just be well, and also show you how to be well. So follow my social media pages, and if you require personal consultation, send a message, book a consultation session. Let's help you, guide you. You don't have to be sick to require guidance. Sometimes you need knowledge, and the knowledge doesn't come cheap, doesn't come free of charge, apart from the one that I'm giving free like this, so you can do that. But until next week Sunday, 6 o'clock to 7 o'clock, I'll see you. Stay well and stay safe. Bye.